Welcome, everyone. Thank you for joining us today at our monthly Policy and Advocacy Forum meeting. This month, we have the great pleasure of having a speaker, Dr. Vivian Pierce McDaniel. Please join me in a warm welcome. I had the great pleasure of meeting Dr. McDaniel recently at the White House Nursing Roundtable on extreme heat. She is the immediate past president of the Central Virginia chapter of NVNA and is the vice chair of the NVNA Health Policy Committee. She is a prolific advocate for justice, and Dr. McDaniel also chairs the Virginia Clinicians for Climate Action Council for Health Equity and Climate Justice. Welcome, Dr. McDaniel.
Thank you so much. Thank you for that warm welcome. I appreciate it. And thank you for thinking of me and extending this offer for me to speak. I never turn down an offer when it's about climate action unless it is a conflict on my schedule, which actually was a conflict today. But but I called them and told them, look, I have to go and meet with my colleagues um, here with the Alliance of Nurses for Healthy Environments. So I'm going to go ahead and start my PowerPoint presentation. And I also need to go, hold on one second, share my computer sound because we forget to do that. And then we're wondering why people can't hear certain parts of our presentation. So, again, thank you. As you can see, well, here's just a picture of me. I normally just talk a little bit about how I got where I am with climate action, and one of the ways that I got involved in climate action is because of where I was raised. I was raised in a small rural town in Surrey, Virginia. It's a small town called Claremont, Virginia. I lived across the street from a cornfield, and in our county, they constructed a power plant. And it started around 1968, the construction, and then it opened in 1972. And no one warned us about the dangers that would happen from the release of the radioactive contamination, and then we lived in a medical desert, so that made it even worse because there was no hospital within a 25-mile radius unless you caught a ferry boat across the river from Surrey to Williamsburg, Virginia. So, that always, even as a young child, I grew up with like civil rights in my DNA. So I used to see my family members picketing and marching for certain things. So even as a young child, I knew that there was some danger in having that plant in our community. I always like to ask people, what's your passion? Well, of course, mine is climate action. And I stole this picture from you all where I wanted people to know when I did a presentation recently on legislation and how people can get involved. The I was so impressed with the fact that your organization convened these 26 different organizations in Washington, D.C. And if you look at the bottom, I did throw in my Virginia Clinicians for Climate Change at the bottom, even though they were not invited guests. I was there representing both the National Black Nurses Association and Virginia Clinicians for Climate Action. So, in this picture, it has us looking as though we're on the lawn of the White House. So on September the 9th, the Alliance of Nurses for Healthy Environments convened those 26 nursing organizations, of which I was one of the invited guests. And again, thank you so much for that. And it wasn't the first time. I learned that during our meeting that it wasn't the first time that they had done this, but just amazing that that this organization exists and that they have been doing this work for a while. And only a few nurses were selected to speak. We all gave very powerful speeches, I feel. What I missed from my speech was sharing my story. And I was so excited, I forgot to share my story about my patient who had COPD, who had no access to care, lived in a medical desert, and it was caused most likely by the chemical plant that was also about 25 miles from where we lived, and again placed into a historically marginalized community. So we talked about the impact of extreme heat, and one of the things that I discussed was the impact of extreme heat to migrant farm workers and migrant farm workers. And I say migrant farm workers because they are most likely not going to have access to care the way that some of the other farmers might have. And then over the road truck drivers, because they're sitting in a truck with the heat beaming down on them, and elderly and children who live in trailers without any air conditioning. So those were kind of the topics that I discussed. Then here we are at Environmental Protection Agency. And I'm going to share with you the photo that we took there, that was taken by one of the officials who works there. I don't know if you've seen this photo already or not, Millie. I don't know if you have seen this before, but
I
in this pit, you did? Okay, good. In this picture, we're with the environmental officials from the Environmental Protection Agency. And we, again, the most significant part of this event, of this meeting, was the sharing of stories to the extent that I believe he was the vice administrator that spoke to one of our presenters and said, she had shared a story about her family and how she was the first person to be able to go to school. And she also shared that her brother was an engineer. And he quickly said, tell us about your brother. Let your brother know that we are looking for engineers here. So you see the significance in sharing the story. You never know what's going to happen after you share your story. So they talked about topics, they talked about the social determinants of health, and it was just an amazing meeting. And I just want to share with you very briefly, I'm trying to monitor my time. I want to share with you very briefly what one of our persons said. He is the president of the Philippines Nurses Association. So let me click on it.
So an Air Force nurse. And I'm saying that not to have a chip on my shoulder, but to let you know that as of, well, for the past 2 nights, I've been getting emergency alerts. We have a wildfire next to March Air Force Base in California right now. One of my sergeants emailed that he's in Orange County and they just got evacuation orders. So truly a testament that environmental disasters affect all. So in the Air Force, we live by the principle that early is on time is late, and late is unacceptable. This ethos is particularly relevant as we confront the growing challenges posed by extreme weather events. While strides are being made to protect our communities, significant gaps remain, especially for those most at risk. Extreme heat in particular affects everyone, but it disproportionately affects individuals and communities lacking the resources to recover swiftly. The harsh reality is that those who can least.
Okay, so I just wanted you to, the reason why I wanted to share that, I wanted you to see how he started with his story, and then he started sharing some information about extreme heat. So I have so many clips that I could have put there, but I guess because I too was in the Air Force Reserves, I was a little biased there. Sorry. So you see how easy it is to speak about policy, the issues that matter to you with the decision makers and with lawmakers. So was asked to talk a little bit about Virginia Clinicians for Climate Action. And that is the organization where I'm the chair of the Council for Climate Justice and Health Equity. You'll see that I change up. Sometimes it's the Council for Health Equity and Climate Justice. It depends on what mood I'm in, but you get the gist of it. Um, so our mission is to educate. That's what we do mostly. This organization was started a while ago by mostly physicians. In fact, there was only one other nurse on, associated with them when I came on board. They just recently changed to a 501c3 organization. So we're going through some different changes right now. But the work that they were doing, research and all of that, it had already existed. And you'll hear them saying things like climate change is real and it's a threat to the health of Virginians, people living in Virginia. And so they focus on protecting their patients, the communities, educating their patients. We have one physician, I think she's a pediatrician. She's on the council with us, me and another nurse. Is one physician and two nurses. And she does a lot of talks about how her patients are impacted by climate, and she talks about her asthma patients mostly. And so it's a lot of education, it's a lot of research. We just got two new fellows that are in our program who will be working with us, and one of them I know is from VCU. I forgot where the other one is from, but we absolutely adore them because they do a lot of the work that we need to get done, especially when we're trying to do research. And we do a lot of policy work. So we focus on policy, climate solutions. We focus on that type of policy. We are nonpartisan, but I feel that because most of the people that align with us may be from a certain party, that we end up working with them more closely. And they believe that though a healthy environment is extremely important and it's fundamental to health, that our expertise lies in the policies and programs that address the human health impact of climate change. So a lot of them are, again, like I said, the majority of them are physicians. It was started by a physician, but we also work with faith-based agencies as well. And we always, even before we started our policy, our social climate policy group, we always focused on climate justice as it applied to social justice. So a little bit about them. Okay, next slide. So here I am, all about my work in Virginia. and in Congress, because the picture with the young lady below that says Climate Action Now, that's Congressman Jennifer McKellen, and she is a true advocate for climate change in Virginia. She and Donald McEachin, who passed, she took his spot in Congress. They have done so much in Virginia, so much climate justice and social justice and climate action. And I am so thrilled to be able to work with with Congresswoman McKellen. In one of the pictures, you see me there with Julie. Julie is an electric school bus. And we all got to ride on Julie. Yes, we all got to ride on Julie. And Julie it was like, I don't hear anything. What happened to that diesel that was choking me as a child when I was on my way to school on the school bus? I don't smell any of that. I don't hear it. And Julie was so kind to us, even though we did have to open the door because something happened to the door. And the bus was so new that the guy couldn't figure out how to fix it. So, but that was very exciting. We do a lot of town halls, providing climate solutions, and then at the bottom, this was one of the things that I did with the faith-based community, and I really enjoyed doing that. So again, VCCA, Virginia Clinicians for Climate Action, collaborate with community leaders to educate and empower the public. We do it around local, state, and federal policies, anything that's related. In fact, there's a statement up at the top where I had to speak against our governor who repealed our regional greenhouse gas initiative, which we call Reggie here in Virginia. And the program was voted on and put into place, and it returned nearly $590 million in revenue to Virginia to fund for things like flooding. Now, you see what just happened in North Carolina and in other areas down south. Well, our governor repealed it. We're still fighting for it right now, but it the energy efficiency efforts for these power plant pollution. It encompassed all of that. And so we were really upset about it. So I think it was about three different news outlets that quoted me when I said what I had to say about it. And what I said was, as nurses, I don't know if it's this one or not, but I remember the one that I said most specifically, as registered nurses, it is incumbent on us. It's incumbent on us, on me, to advocate for environmental health, especially for those persons who are residing in underserved, at-risk populations. And we have a lot of people living in Appalachia, and those people are very much impacted by climate change. So I talked about that, and I said we deserve to live in a world, in a state free of toxins. So that was one of the things that I said, and I already talked to you about the triple bottom line one. Then that one I talked about all of the money that people are paying for healthcare in Virginia, and the people that are the most affected, the most impacted by climate change, they can't afford to pay for care. The majority of them don't even have access to affordable health care. So I felt that that was important. And then I wanted to, how much time do I have? Am I good? Okay.
Good.
I always like to mention this whenever I speak. As nurses, we are positioned, uniquely positioned to impact health policy, legislation, and all of that. We don't have to do it sitting where we are sitting now. We have two nurses in Congress, right? Two nurses on both sides of the aisle. There is absolutely no reason why one of us, okay, can't run for Congress. Not just Congress. How about run for your run locally? Run as a council person in your city. Run for a state representative, right? There is absolutely no reason why we can't. Lauren Underwood became a nurse at the age, became a congresswoman at the age of 32, the youngest congresswoman, or the youngest congressperson, period, the youngest representative in Congress. And when she ran, uh, she had thought about all of the things that had happened to her. I think she has a congenital defect. I can't remember what she told me it was, but she has dealt with a lot of things throughout her life. So she made up her mind to run for Congress. And then Jennifer Keegan is actually from Virginia, and she was a fighter pilot before becoming a nurse practitioner. So I've spoken to her on numerous occasions, so I know she has a lot of guts, and she doesn't mind taking on things in Congress when it applies to nursing and healthcare. So I wanted to just speak very briefly about healing politics. Now, look at this sign. Don't just march, run for something, right? So we have healing politics. I have no money invested in healing politics. I'm just saying, if you want to consider even being a person who's doing work in politics, because whether you believe it or not, and I think you all know it, or you wouldn't have convened those meetings in September, there there's policy and politics involved in nursing. We all know that, right? So just think about it, because I'm never going to give a presentation and not bring it up. Think about it. Think about what you can do. And you don't have to just march, you can run for something. And then I always like to leave people with the words of my good friend. I don't do a presentation without ending a presentation with this. So I'm going to share with you.
My philosophy is very simple. When you see something that is not right, not fair, not just, say something, do something, get in trouble, good trouble, necessary trouble.
Just remember, climate change has a devastating impact on all populations, but most specifically, people living in historically marginalized populations and communities. So again, I say it is incumbent on all nurses to please advocate for health equity. I know I'm preaching to the choir here. I don't have to say it to you. But it is definitely time for us to get into good trouble and necessary trouble. Thank you so much.
Oh my goodness. Oh my goodness. Thank you so much, Dr. McDaniel. That was powerful. Um,
Thank you.
I have so much to say, but I know that I'm just a moderator, so I have to leave space for everybody else. Can I just ask you one question? Were you in one of the cohorts for healing politics?
Was not. I don't. You saw Chris Otto. He was with us in DC, so he was one of the persons that was there. Danielle McCamey was another person, and I had another. I can't remember who my other person was. That was Ashley Apple is from Virginia, and she was our governmental person for Virginia Nurses Association. So I haven't gone to one of them yet, and but I am strongly considering it. One of the reasons why was because there's an organization here in Virginia, and some people wanted to fund me to go to that one, and but that one isn't just for nurses. So I definitely will consider going to Healing Politics.
I thank you so much for that. I actually was in the first cohort, and I will say this, I went on scholarship. They do have limited scholarships. Um, I have absolutely no interest in running for politics, but there is a barrier with among some nurses, some colleagues who maybe need, like myself, maybe needed to understand the process and really understand the logistics of of everything from, you know, the money that flows to the politics behind the politics.
Yes.
And so it's hard to be an advocate if you don't really know what lies behind the curtain. So for that, in that sense, it was a very good experience. I highly recommend it, and thank you for bringing it to the group. Does anyone have any questions? Because I can go on for quite a while.
I actually have a question. Thank you so much, Dr. McDaniel. I am from Delaware, so I'm familiar with Chris Otto, and and he's been doing a great job trying to get nurses to run for office.
Yes.
My question is, one of the things that I think we run into as nurses when we talk about climate is there's so many other things going on. You know, we're coming off we're still in COVID in so many different ways. We're still, there's nursing shortages. Your presentation today was so powerful, but how do you, explain to nurses that like this is part of what we're already doing and kind of making that connection? Because I feel like sometimes it feels like just another thing we add on to like, can you ask them
Well,
about, or, that kind of
yeah,
thing?
appreciate that question. Thank you so much. First of all, I do teach health policy. That's what I teach. And I don't understand why, if we are taught the social determinants of health early on, I don't understand how people still ask the question about what do we have to do with the politics or what we have to do with policy. But what I do is well, I'll tell you what I do with my students, and this works every time, uh, is that I give them a bill. I find a bill that was passed. I give them that bill, and I have them to follow that bill from its inception into up until it was passed into law. I I actually haven't run across nurses in today's times that are questioning it a lot, but I have had that question posed to me on numerous occasions. It's just that I guess I must be hanging around the right people. I don't know what that is, but no, I would just explain to them, go to the basics. Ask them to share a story with you about a loved one or somebody that they know is struggling with health care. They're struggling with being able to pay for a prescription because it costs too much, or they're struggling with some of the other things that are associated with social determinants of health. I always go back to the basics with them because they understand that better, you know. So that's how I approach it, and I always lead with a story, because even if they don't have a story to share, I have a plethora of stories. So go back to the basics with them, to try to get them to understand how significant it is. And your voice matters. I'm a little bit upset because I normally have on my Climate RX uh, lanyard. Yeah, I know. You know, I had it with
Yes,
me the whole
yes,
time. Yes, the whole
yes.
time I was in DC, and put it on a list of things not to forget for today, but still forgot it. But yeah, that's what I do, Sarah.
Thank you so much. And I do see that Ms. Latricia Gordon has her hands up.
Hmm. You muted, Latrice.
See here, sorry. Hi, how are you doing? I
I'm
love
fine, thank you.
I saw your book back there. I'm a part of the DNP of Docs of Color as well. Thank you for all the information that you provided. So how would you like to get involved? What type of organizations would you suggest other nurses to get involved with? Me and my coworker, Ms. Martin from Flint, Michigan. And, you know, we are do a lot of environmental climate issues here. So right now, me and her and myself, we're, you know, on the battlefield front line, boots to the ground, grassroots, working in our environment, but also how to, like the incentives, like you say, to get other nurses involved. Like I don't have the time. And also inside the hospital, a lot of people are not looking at the social drivers or social determinants of health as well, to highlight
Well,
those
what
as well.
what I would ask you actually is, are you connected with all of the well, not all, but the reps in your community that are doing the work, that are
Yes,
already doing the work?
yes,
Uh, so there are, I mean, you're in the organization that you need to be in as far
yes,
as doing, as far
yes,
I mean, you guys are doing a tremendous amount of work here, but there are local organizations. I know that there's some local organizations in Flint because um, one of my I knew someone from UVA that was working on the project during the water
yes,
crisis. I don't really know. I mean, you could join organizations like the National Black Nurses Association, who's doing the work, but I work directly with Danielle. In fact, I was just in a conversation with her, and I know that she is doing a lot with what's the young lady's name that went with us, Millie? Oh gosh, she would kill me. I can't think of her name right now,
What
but
organization was she from?
DNPs of color.
No,
yes.
Mimi.
Oh, okay.
Mimi.
Mimi, yeah.
So yeah, Mimi is doing a lot of work with us. I'll be meeting with her soon as well. But
Okay.
I am also asking the National Black Nurses Association if they would allocate some funds for the social justice, the climate justice that I have volunteered to start a council under our health policy committee for climate justice with them, because right now we talk on it and we do things, but it's not a committee that's you know that's doing the work. And so that would be an organization that I would say, and I didn't get whether you were asking me about nursing organizations
Yes, the
or
nursing,
just
yeah,
organizations, period.
right, for nursing organization. I think
Yeah.
I reach out to the chapter of in our city for American Black
For,
nurses.
for yeah,
Yes.
you have a really good chapter. I think they're doing some work, but I don't know if they're doing any work in climate action per se, like that's their only focus. But that's the other organization that I went. And then also, and I'm about to join these organizations. It's just that, you have to pay so much to join all of these different organizations. But the Philippines Nurses Association, the nurses, the National
Hispanic
Association of
nurses.
Hispanic Nurses.
Yeah. Okay.
The problem that I think I see with people is that they think that they don't need to join these organizations because, but, well, those are, I'm Black, so I should only join the Black Nurses Association. No, we have to be allies to other people that are impacted by this. So I would just say that. And I guess the reason why I'm not so straightforward with that is that I tell my students, when I share with my students, I give them a whole list of different organizations, but I try not to sell one particular one
Right.
because I really am. I'm a member of several and I do a lot of work with several.
Thank you.
But you're already on the right track.
Oh yeah, I'm all right. And we also with work Michigan United, we do social environmental justice as well. I'm there as well. So just kind of try to loop those in.
I'm going to visit your town, your city.
Okay.
My cousin, I have a cousin who played professional basketball who's
Oh,
from Flint, Michigan.
uh, who was it?
Trent,
Marty?
Trent Tucker.
Oh, Trent Tucker. Oh my God, Trent Tucker. Is that Tarnisa? Tarnisa Martin? I think that might be some relation to her, if I'm not mistaken. That's on
She
the call.
is, you mean, I think she was a basketball, was she a basketball player?
I'm not sure. No, I think she's on the call now. I think she was a Tucker, but I think she might be somewhat related to him as well. But okay, well, when you come in town, I won't take up any more time. But I'll put my information and we'll show you around and love to meet you in person.
Absolutely.
Thank you
Thank
so much. And I know, Tom, you have your hands up.
Thanks, Mia. A comment and a question. The comment is that I'm reading a history of the 70s, basically, and I'm struck by how I see these names of people doing very low-level elected kinds of positions and things, and now are well-known names. I mean, Reagan got his start. I think he was the head of a union somewhere. Maybe it was the early Screen Actors Guild or one of those, and he was quite the liberal, and he got a strike going and what have you. But so talking our nurse colleagues into running for the school board, running for the local road thing. The only thing you can't run for usually is being a judge, but run for something. That's a comment, and I put in the chat that we've got over 500,000 elected officials in this country, and we had a governor here in Oregon who got her start because she had a disabled kid and ran for the school board and ended up 20 years later being governor. So long view is run for something. My question has to do with the VCCA, which I bet that's not vintage Chevrolet Club of America, but if you do a Google search, you get that. So when you talk to the healthcare folks there and they talk about their institutions, do they ever talk about their climate work in scope 1, scope 2, and scope 3? And if that's a question that's completely somewhere else, just tell me and we'll move on. But it's an issue that I've been sort of wondering about lately because Kaiser here talks about scope 1, 2, and 3.
Yeah, I haven't heard them talk about it,
Okay.
but I do know that one of the physicians, I believe, I think it's Jerry. I don't want to call a name because I'm not sure. I know that he knows about that, but I have really not
Hey,
heard them
Okay.
talk about. Yes.
Jerry Abraham.
Okay.
No, what's Jerry's last name? This
Well,
is this is
my question had, we can move on to other issues, but my question had to do with each of those hills get steeper and steeper. Scope 1's like this, and scope 2's like this, and
right.
scope 3's almost vertical. So I just was curious how people were chatting kind of offline about that issue, but we can move on.
Well, they do. I know that he is very involved and he does. I've heard him talking about it, about the different scopes, but I can't say for sure, you know. I mean, we cover all of the gamuts, like of what these particulates are doing in Virginia, and in fact all over, because they would like to be able to um, be spokespersons for um, what I'm trying to say, be spokespersons on a higher level, like across the United States. In other words, I know that they are trying to do that. But yeah, they I can't really answer and tell you exactly who the persons are that's doing the talking.
Thank you. Thank you so much. Atenas?
Hi, hi, Dr. McDaniel. Thank you so much for presenting today. I'm so interested in all of the work that you do, and I just wanted to like make this as a drop that also running for some of these offices can feel a little bit like a privilege for people because it does take up time, it doesn't pay well, and so maybe that's just a broader question for larger organizations that we join a part of as nurses, and we want to help them and be part of like these cohorts to be able to be trained and understand the current political party and navigation system, but also how can we support nurses um, financially to be able to be in these sort of positions. And I know that's tapping into lobbying, but um, I don't know if there's like a workaround on how we can uplift and bring up people who understand healthcare, who understand the patient population, who can represent the community and be in these sort of positions. Um, and so that was just a plug to say. And then the other thing is that I'm curious, Dr. McDaniel, what your perspective is on how Annie could use their platform or the nurses here on how we could support you in the work that you do, how we could amplify some of the challenges that the community is facing, because I'm sure like living near a power plant is happening in Virginia, but it's also happening like over here where I'm at in Kansas City. So I think it's always been so difficult for me to figure out how can we intersect with one another and uplift your work and your research, and then also utilize that same uh, research, that same roadmap to kind of help other communities along as well.
Yeah, you said a mouthful. There are so many ways that we can collaborate and do this work. I would love to introduce you to the people that make the decisions, most of the decisions with VCCA. Hold on for a second, because I have to go back to Tom for a quick minute about the comment about the vintage cars. The reason why I started laughing is because I am very into vintage cars, by the way. Un- unfortunately, the emissions from from the very vintage cars that I love are definitely a problem. So, but getting back to you, there's so much that we can do to collaborate. I have not, I did not, I shared with them that I was going to DC and that we were meeting with officials at EPA and at the White House. And I haven't had time to really talk to them to let them know all of the things that you are doing. Some of the nurses, the other nurse that works there, that she knows a little bit about what everyone is doing. I feel that just doing education, getting together and doing some educational events is very, very important. One of the things that Tom was talking about, I was talking to you about earlier, was the Reggie. I don't know, I can't remember the rest of the states that are participating since we got kicked out. But that's another thing, making sure that your state stays in Reggie. And Tom, I don't remember which scope that one is under. Um, the greenhouse gas protocol and all of that. But That's one of the things that you can do, finding out what the different people are doing. And because these are people that are not involved in nursing, they don't know what we know, and they're not utilizing us the way that they should be using us, because we're the ones that can give them the information about what's happening with patients, but we also can give them information about how these toxins are debilitating some people, people with asthma, COPD, and things like that. But we always welcome that. That's why we get fellows. I don't know if you all do that with your organization. Do you have fellows as well?
Me too.
Okay. So, you know, I know that they would really be interested in speaking to you, because they were so excited when I told them that I would be doing this with your organization.
No, thank you so much. And I'd love to explore that more too. Just to see if, because of the current, like the previous fellowships that we have done, I was part of the first fellowship, and then I know there's already been a few others. If we've already been able to kind of develop a map of all of the different regions and the different organizations that the fellows were able to work with, because it's really helpful when we're tapping into those that are on the ground, boots on the ground, part of the community, bringing forward some of their concerns. And then the nurses can bring in some of that research, some of that connection between health impacts and what toxins, like you said, they're being exposed to. And instead of reinventing the wheel every time, if we have some sort of like shared drive or system where we've already developed these fact sheets on this type of pollutant, and we've already developed this type of presentation for another type of contaminant, how can we be able to like kind of utilize that in a shared manner among community members? And then I'd love to see that stuff translated as well, because the communities that are impacted, Black and Brown, BIPOC communities, people who don't speak English, or it's not their first language. So it's another way of also helping to empower them so they could advocate for themselves in the same language that they speak in. But I'll stop talking. I tend to ramble.
You're not rambling at all. You're um, saying important things and things that need to be heard. I just feel that a lot of times we kind of stay in the healthcare field. We're not going to places that we need to go to talk to people about these things. It's just like the there was something that happened here. In fact, I'll have to go and speak next week, I think on Wednesday. This We are literally going to these energy companies. We are going to like Dominion Energy. I found out some things, and I won't share here because you're recording, but I found out some things that kind of disturbed me about funding to some of these organizations that's coming from these energy people, and why they don't do more because of that. They don't want to lose the funding. And that it was very concerning. It really bothered me a lot, because I had family members that were associated in it, and to learn that they were actually contributing money, receiving money. And then it was a company that we were often going to, trying to get them to listen to us and to look at the research and to hear what we were trying to say. And now I found out why they're not listening to us. So it's it's really it can be very frustrating.
I mean, I've seen some of that same experience over here where uh large energy industries fund organizations to plant trees, but they're not doing anything else with the actual electric grid and what we're getting, what sources we're using. If we're really talking about climate change and the impacts, instead of just planting trees, we should be looking at cleaner green energy. We should be looking at not cutting people's electricity when it's in the middle of summer and we've got vulnerable communities that are elderly having to live like that. So I completely understand what you're saying.
Yeah, and then the lawmakers too are like, our hands are full. We can only go as far as they allow the bill that we're working on to go in Congress, and things like that. It's it's a lot of work. And when you think that you are getting somewhere, you're moving up, you're escalating it to a higher level, you find out that you're really not, because there's something that's going to knock you back down, and it's frustrating, but you have to continue and have to keep doing the work. You just can't stop. It's like the place that I'm speaking, where I'll be speaking on Wednesday. they're trying to they're trying to put a gas plant in this particular area. But really, according to the laws here, they're supposed to be um, they're supposed to be getting rid of all of these things by a certain year. They're not doing. I mean, why are you erecting one now if you have to get rid of? So it's just crazy.
Thank you so much, Dr. McDaniel. We have 3 minutes left, so I wanted to open that up to anybody who had a lingering question or comments.
And it's Jerry Paulson, by the way.
Okay.
Yeah, I was trying to look it up. I'm like, Jerry would kill me if he knew I didn't remember his name. But it's Dr. Paulson. I believe he was a pediatrician in Virginia when I want to say he founded VCCA,
I,
and he was a
I'm familiar with,
pediatrician.
yes, I'm familiar with his name. I was
Yeah,
thinking of another Jerry, but that Jerry is someplace far
oh,
away.
yeah,
But
yeah. Jerry is very well known here for this work.
it's very encouraging to hear you speak. I would just offer, this is it as we have to hold each other up because it can be very disheartening. And holding each other up can look like different things, including pulling each other into places where we normally maybe wouldn't have been, to really allow and force a space opening to give each other space to speak. And sometimes, we all have different personalities. Maybe running for office is not your personality, but you know what? Maybe writing a letter is, maybe supporting somebody else who can run for, who has that disposition of being able to do that. So we all have a role to play. I would urge everybody to look at their if not their national chapter, then their local chapter, whatever organization they belong to, and encourage, as Dr. McDaniel said, that uh, a committee, a task force, and this isn't really a task force type of thing because there, it needs to be something that goes on.
Mhm.
But in any which way or form, start the conversation, because guaranteed there are chapters among many different nursing organizations that have absolutely nothing um, to, that involves the environment, climate, or anything to do with that. So look at your chapter, look local. And also to Dr. McDaniel's point, silos do not serve us. Find ways to build bridges across sectors, even if it's just locally. You would be amazed how much good you can do just by starting that conversation, asking that first question, volunteering your voice.
Absolutely. Absolutely. We are working on trying to get, I serve on the board of 3 hospitals, and they still haven't gotten me my report back. Tom, they haven't gotten me my report back about what we are doing in the OR as far as and see, of course that's under one of the scopes, but they also, but we did get a bill passed in Virginia on that. So that's another thing that I think that you should do. If you're associated with a hospital, you need to figure out if they, what laws they have, because you know those emissions in the OR and what they're doing. So just wanted to end with that.
Thank you so much. And it is actually on the hour. So I'm going to stop the recording now.